The 10 essential public health services were developed to strengthen and organize the nation's public health infrastructure. This video is brought to you by the Northern Plains Tribal Epidemiology Center and the Great Plains Tribal Chairmen's Health Board. There are 3 identified fundamentals for public health: assessment, policy development, and assurance. The 10 essential public health services fall under those fundamentals. This video briefly describes the 10 essential public health services and shows why they are essential to managing public health. The example used to illustrate each service and support prevention is the rising rates of sexually transmitted diseases, or STDs, in our Northern Plains tribal community. The first service is to monitor health status and to identify and solve community health problems.
IHS and tribal health providers report infectious diseases to state health departments. State health departments then provide this information to community leaders to help them monitor and assess community health.
The second service is to diagnose and investigate health problems and health hazards in the community.
As an outbreak is investigated, the data tells us who is most affected. For example, we see the most gonorrhea cases among males and females aged 15 to 29.
The third service is to inform, educate, and empower people about health issues.
Data shows that teenagers and young adults are most vulnerable to contracting STDs. Clinics and schools can help by handing out educational materials about STDs. Tribes can run public service announcements on the radio, and IHS can provide information on Good Health TV.
The fourth essential public health service is to mobilize community partnerships and action to identify and solve health problems.
A community mobilizes when people become aware of a common need and decide to take action. Once a community is mobilized to address STDs, it can begin prevention activities. Strong partnerships are critical. For example, we have helped several communities mobilize by partnering with tribes, community members, tribal clinics, and tribal schools to implement an STD prevention curriculum.
The fifth service is to develop policies and plans that support individual and community health efforts.
Some tribal clinics' policies are to automatically screen people who are at risk for STDs. The clinics test urine samples in school, physicals, drug tests, or for other reasons. Some clinics also support expedited partner therapy. This is when the doctor prescribes medicine for the infected person to take to their partner who otherwise would not come into the clinic.
The sixth service is to enforce laws and regulations that protect health and ensure safety.
When a person tests positive for an STD, someone from the state or the clinic will contact them and help them get treated so that they do not spread the infection. However, in an outbreak, so many people have chlamydia and gonorrhea that there may not be enough healthcare providers to visit those who test positive. Some tribes have public health codes that penalize a person with an STD who knowingly puts others at risk.
The seventh service is to link people to needed health services and assure that healthcare is provided.
If STDs aren't diagnosed and treated early, they can spread and cause more health problems, including the need for surgery and long-term care. Healthcare providers offer referrals and services for those who need this extra care.
The eighth service is to assure a competent public and personal health care workforce.
In the case of STDs, the Great Plains Tribal Chairmen's Health Board asks STD experts to train clinical directors and staff. State health departments also employ disease intervention specialists. These specialists work with public health nurses to make sure that tribal communities have providers who know how to manage STDs.
The ninth service is to evaluate the effectiveness, accessibility, and quality of personal and population-based health services.
Because we have investigated the STD outbreak among Northern Plains tribes, we know what needs to be done and could assist in the evaluation of these recommendations in your community.
The 10th and final service is critical to the other 9. Research for new insights and innovative solutions to health problems.
The Great Plains Tribal Chairmen's Health Board anticipates that resistant strains of gonorrhea will show up in our region. There are new and easier ways to screen for STDs.
Using the 10 essential public health services has proved very helpful as we battle the rising rates of STDs in our community. These 10 steps are designed to produce success in any public health project. For more information about how to use them in your next project, call the Northern Plains Tribal Epidemiology Center at the Great Plains Tribal Chairmen's Health Board, 605-721-1922.